I guess everybody's here, so we probably ought to do something. My name is Brian Mills. I'm the president and CEO of the Community Health Network, and I'm just delighted that you all would all come spend a little bit of time with us today about our big announcement. Before we get started, I have a few people that I want to recognize who are here. State Senator Patricia Miller. She's actually going to speak here in a few minutes. And I will say, just through my own observation, one of the hardest working people in the state legislature is Patricia, no doubt about it. I saw Bruce King, one of our board members, slid in the back and trying to hide, but one of our very active members of our network board, Jessica Tower from the Lawrence Chamber. We're Jessica. We were at an event yesterday together we were talking about, so we're fast friends. Dan Cannon and Mo Merhoff from the One Zone Chambers, the combination of Fishers and Carmel, and Carlotta Sullivan from Lawrence Township Schools, one of our many school partnerships. Thank you all for being here. And we also have an array of physicians, of our staff, of other people within the community, some patients, many of our leadership team, and we got some news for you. And I'm going to give you a few remarks on what we're doing in broad terms and why. And then I'm going to ask Dr. Janan Grable to talk about what we're doing here on this campus. And then I'll talk to you about what's happening on our East Campus. And then we'll have some closing remarks and answer your questions that people may have. So what's going on? Well, what's going on is this. About 60 years ago, community started providing healthcare services on the East Side for the citizens there. And that's been our mission ever since. And what we do is that we try to provide services, so we try to provide the best experience to patients. And that's what drives us, to try to make sure they get the best outcomes possible. And when we have fortune, we're in all these changing times, you know, this healthcare business has been tough. Not looking for any pats on the back or anything about this, but we've been fortunate that our team of people working together have been able to do this in a way in which we've had surpluses. And surpluses are a good thing. The question is, what do you do with them? And our mission, our purpose is to make sure we reinvest dollars we make back into the communities we serve. So today we're here to talk about major investments. We're going to invest over $250 million, really $250 million, big number, into both our North Campus and our East Campus. And the North Campus will be a replacement oncology center for the one that's been here for a long time, about 25 years ago. Matter of fact, I remember the day that Susan Bai was here to cut the ribbon when she was the First Lady of the State of Indiana. That's when that happened. And at the same time, the campus we're sitting on very soon will be 30 years old, believe it or not. I looked in my old calendars, 30 years ago today, we were doing open houses in this facility. It didn't look quite like this. Getting ready to open this new hospital in the middle of nowhere. And I'm proud to say we're still here and we're growing and thriving. The second part we're going to talk about is reinvestment into East. I'll go into some more details here in a few minutes, but we talked last fall about a project to do a revitalization, reinvestment into East. We're still doing that. But we spent a lot of time trying to say, are we getting the best value we can out of the $175 million we're spending? And our answer was no. We can do better. So we've got a project that's a better project that's going to do more for the East Side and make that a destination place for citizens for a lot of reasons, including their health care. So that's why we're here today. We're going to talk about what we're going to do with these investments and why. And I'm going to turn this over to my friend and colleague, Dr. Janan Grable.
Thank you, Brian. I can't tell you how excited I am to be here today. This day brings me back to 5 years ago when Brian came to our department. He asked for a tour, and he asked what the cancer program needed. What I didn't understand and underestimated at that time was the determination of the administration at Community Health Network to support the growth of cancer program. I'm so pleased with the commitment of the administration to provide the best tool possible to serve our patients. Since that time, we have made tremendous amount of growth. First, we have formed an alliance with the best cancer network in the world, MD Anderson. Last year, we added a new cancer center to the South Campus. Now, we are adding this new $60 million cancer center to the North Campus. It will be a 3-story, 105,000 square foot facility that will be located just off Shadeland Avenue, south of Community Heart and Vascular Hospital. And it will be connected to this building by an enclosed skywalk. During the design process, we have reached out to countless physicians, staff, and patients for their input, and the design of the center is rooted in 3 guiding principles. First, the facility will be patient-centered. Throughout the emotional journey of cancer diagnosis and treatment, patients frequently feel a sense of loss of control. So the space in the new cancer center has been designed to maximize patients' control over their environment, whether it is the room temperature, lighting, or entertainment. Secondly, we want patients and their loved ones to be able to maintain as much of their normal life as possible. To achieve this, we have created a medical home away from home. There will be conveniences like Wi-Fi, workspace, Skype, healthy food, and access to medical information. Third, patients and families are more successful battling cancer if there's a sense of spiritual well-being. This center has been designed to provide as much natural lighting as possible. In addition, there will be access to a meditative garden as well as a chapel. The center has been designed with an eye toward the future. Throughout the design process, we have built in the flexibility to accommodate future healthcare changes and change in technology. I want to thank thousands of patients who have entrusted their lives to us during their courageous battle with cancer. I want to thank our dedicated staff who has been waiting for this new home patiently and always put our patients first. I want to thank our administration and the board for making this new cancer center of the future a reality now. Now I will turn it back to Brian.
Hey, Janan, thank you so much for your remarks, also for your leadership on this project. I know without a doubt you're not very big. Well, neither am I, but she carries a loud voice and a determination that this will be done right. And it'll be done with our patients in mind. And when it's all said and done, their experience is what's most important to us, as well as their outcomes. Okay, so Community East. We said last fall we're going to spend $175 million to reinvest in revitalization of Community East. And we intended to do that. As a matter of fact, we plan on being under construction by now. But Scott Tiefteller's here in the front row. He's the president of East, and he came to me a few weeks later and said, Brian, I think we can get more value than what we're getting right now. We're spending a lot of money refurbishing an old plant. He said, will you give me the latitude to work with some people, some architects and engineers, to see what value we can get, and can we get more for $175 million, which is a huge sum of money. And he came back with a plan that's remarkable. And that plan says for $175 million investment, we can get a new hospital. Not a refurbished hospital, but a new hospital. And a new hospital on the same site. And that's critical for people to know, because when we stood up here, Scott and I, with Mayor Dennis Buckley from Beech Grove and Mayor Greg Ballard from Indianapolis last fall, we said we were staying on the east side, and that's unchanged, and we're staying on that location. But we can build a new hospital while running the current hospital and build it literally behind where it is. And several things happen. We can do it quicker, 2 years quicker. We can do it with no more cost. We can do it with efficiencies going forward that will save us a minimum of $4 million a year in the operating costs. We can have minimal disruption to what we're doing, and when it's all said and done, we got a new facility. And we have a facility that the east side residents will be proud of, and they understand the investment that we're making into the east side of Indianapolis. So that's what we're doing. So when we start construction here in a couple months and buildings start coming down, please remember other buildings are going up. because there's old buildings. That hospital was originally 900 beds, massive plant. We don't need 900 beds anymore. Healthcare's changed. Most of it's outpatient. We need beds, but a much smaller footprint. And so you're going to see 3 phases. You're going to see buildings come down. You're going to see a new tower go up. You're going to see a whole new entrance and pathway by which patients get through occur. You're going to see the residency program relocating back on campus from where it's currently off of campus, and we're expanding our residency programs, and that's all going to happen starting this summer, and it will conclude over the course of the next 3.5 years. So that's what we have to share with you today, and we're so proud to be in a position as an organization that we can make this investment into both of these projects. So in addition to that, I'm so delighted once again to have Senator Patricia Miller here with us, and she's willing to say a few words and talk about her love as well for the East Side. Thanks, Pat.
Thank you, Brian. And the very first thing I want to do is to congratulate you and your excellent staff on your vision and the vision of others to move forward with this project. And I think this project is short-term and long-term. And in the short term, I see the construction at both sites as jobs and opportunity for economic growth, particularly on the east and southeast side of Indianapolis. And that's always a thrill and exciting for us to see and have. I'm excited about the project. I told someone earlier, maybe Ann, you're tearing down some of my history, and most of you probably don't know, but right after I graduated from the Methodist Hospital School of Nursing, the old 3-year program, I worked at Community East, and where I worked is gonna go. And my mother was also a registered nurse, and she worked on 2 South Tower, and apparently that's gonna go, correct? So I'm still glad to be here. But I spoke just briefly about the short-term growth of what's going to happen with construction. But the bigger part is what I'm really excited about and so happy about. First of all, it provides better and more access to patients. And with new technology, it's going to provide better care for patients. And it's also going to build staff. And one of the things we're looking at, and one of the things we have an issue with here is we are graduating more medical students than we have places for residency for physicians. So we want more doctors and nurses and people to stay in Indiana. So if you can hire more people in these facilities, we really appreciate that. So I'm delighted to be here. It's exciting to see your excellent staff and the people here are supportive. I'm very supportive of the East Side. I've been almost a lifelong resident of Warren Township, where Community East is, but I'm very partial to Marion County. I'm committed to this community, and I'm glad to see it grow, and I congratulate you again.
Senator Miller, thanks for your comments, and we might mark those places where you were, just to make sure that they're not forever forgotten. In gold, okay, or platinum. Or so that concludes our remarks today, and we'd be glad to take any questions from the media that you might have and try to provide more detail. Yes, sir. Oh, we sure do. We see this truly, when we said revitalize, which was the initial thing, the vitality piece is what's so important there. So therefore, for instance, we through this, we have a lot of businesses. We employ, we employ as an organization 12,000 people. We have about just over 7,000 are in Marion County. So the more jobs we create creates more business opportunities, and then partnerships that we have with the schools and the churches and the civic organizations bring that together and say, okay, what can we do as one? We can't stand here on an island. I mean, our point as being a healthcare provider is that we can't only be a part of the community when people need healthcare. This is our community. We got to be a part of all the community, and that's something that we specialize in. So as we work together, we can identify other opportunities to bring business, to bring jobs, to bring housing, to bring safety, to bring all the things that people are looking for, schools, quality schools, to those areas. I have no doubt, because Scott and his team have worked with numerous 35 or so community organizations in the planning of this and saying, okay, how does this help wellness? How does this help nutrition? How does this help education? How does this help provide a place that people can convene? And all those parts, all those things are part of our planning. Great question. So, it plays into it, Sherry's with the Indy Star, how it plays into it is that they have been involved with what we're doing. We've taken their wisdom, we've shown them our plans, they've given us their ideas, they've done this time and time again. They've told us to think about various ways, and amazingly, so much of it relates to the patient experience and what they've learned elsewhere. The other thing is, we are including space for research and consultation so that we can work with them to expand the research that we're doing locally and interact with them through various forms of teleconferencing and those types of medium. So it really is to try to make sure this is something that they, while they don't own it, that they have had a part in the design. Well, thank you all again for being here and taking time out of your day. We've got a lot of work to do, and we're going to get at it. Thank you.